Good morning, everybody, and welcome to Webinar Wednesday, and welcome to another in the series of our webinars, just to try and stay in touch with the food industry during these very interesting times, and to make sure that we can assist and support the food industry in every way that we possibly can. For those, you can also expect to hear from Facts, because we'd like to thank them today for sponsoring this webinar. I think it's really great to see the interest that this webinar has generated. We have definitely had the most registrations rather for any of the webinars that we have ever hosted. So well done to Facts, because that indicates that there's definitely a need for the information that they're going to share with us today. And we're really looking forward to it, because it seems like it's something that is very, very timely from that perspective. So thank you very much to Harris and the team at Facts for the opportunity to chat to you today. Before I introduce Harris and chat to him, I think it's important that we just stop for a moment and we just look at the world around us. And so the reality is that we are faced with a pandemic, and we are faced with a very abnormal situation currently, and that is definitely not something that any of us are really comfortable with. It's uncharted waters. We've never been in this position before. And so we are, I think, looking at with a lot of attention in one area, but there are possibly other areas of our business where we need to be paying just as much attention. And I think that's the reason for, Facts wanting to remind us that there are areas where we may be vulnerable, and particularly at this time of crisis. There may be areas where we are not focusing, but as a result, we are potentially exposed to other risks, other hazards, and not just the current pandemic. And so, first of all, I would like us to have some conversation with Dr. Harris Steinman. And I think what's really great about Harris is that he is a medical doctor. And so he is the CEO of Facts. As you can see, his background, Facts is a very specific niche organization that provides expertise in food testing, regulatory advice, nutrition, and food fraud. They keep us up to date on an ongoing basis about what's happening within the food industry. As you can see, that Harris has many years of experience, very practical experience in the food industry. So not just as a medical practitioner, but actually using his medical expertise within the context of the food industry, and focusing on vulnerabilities, areas where, as a food company, we could be exposed. Hi, Chetan, I see that you're back. That's great news. You can see Harris has had a number of very distinguished opportunities, and in relation to the UN and the WHO, FAO consultations on allergens, and this is definitely a pet area. He is absolutely passionate about allergens. And so he's been involved extensively in food fraud. I think probably his research of 2013 around the horse meat scandal is really something that kind of brought him to the fore in that respect. And so it's an area where I think he's continued to put a lot of work. But today we're not talking about horse meat, Harris. Today we're talking about this virus that has got us all into a bit of a panic about this pandemic. And I think, what's important to bear in mind is, I'd like your opinion in that regard, is should we be concerned about the virus and the possibility of it being transmitted through food? Harris, over to you, and it might help if I allow him to speak. Harris, you can talk now.
Hi, Linda. Thanks very much for that introduction. I'd like to thank everyone who's joined us for joining us. I appreciate that you're working under unusual, if not stressful, conditions. I would like to point out that obviously our knowledge, although I'm a medical doctor and I've got particular pet interests, that my team is a mixture of food scientists, food technologists, dietitians, biotechnologists, microbiologists. And so, you know, there's great cross-pollination. So when we look at this particular topic, obviously, we're looking at it, I'm representing a number of hats. To get back to your question, Linda, you're absolutely correct. And thanks for that intro. I think before we start, let's just address some of the naming conventions. There might be some confusion here. So the disease that people are experiencing is called coronavirus disease, or abbreviated to COVID-19. And that 19 doesn't mean we've had 19 COVIDs, as some of politicians claim, but simply that it was emerged in 2019. The virus that causes this condition is called severe acute respiratory syndrome coronavirus 2, or abbreviated to SARS-CoV-2. So SARS-CoV-2 causes the disease called COVID-19. Now, there's good evidence that coronavirus is not transmitted by food to humans. We've learned that from previous coronavirus outbreaks, such as SARS and MERS. However, there's some evidence that contamination of surfaces may be a risk. But to date, and I want to stress that, to date, there's been no reported cases of infection via this route. So the precautionary principle applies, and that is that we should still minimize this risk by implementing adequate strategies, preventing potential cross-contamination from these sources, whether it's in a factory or whether it's to your consumer in the final retail outlet. However, as you pointed out, Linda, that it has a direct impact on food security and on the food industry, with major impact on food businesses. I want to point out that coronavirus is not just a risk to your consumer, but to your staff, to your operational activities, to your suppliers, right down the food chain, as well as the increased risk for food fraud, because this is when food fraud particularly raises a specter. So we focus on retail and manufacturing workers, but the whole food chain is affected. If farm workers are affected, the whole supply chain may be impacted because raw material is not going to get all its way up. And although we focus on the risk of being infected by COVID, we must consider the fallout and effect of tectonic levels of anxiety, fear, and stress on our workers. And this needs to be addressed and dealt with. You know, it doesn't help that your workers suddenly don't arrive at work, or they are short with your consumers or clients. And so we need to understand that uncertainty triggers fear. And the problem with COVID is we don't know enough yet. So there's a great amount of fear leading to misinformation, to conspiracy theories. And what we need to deal with is facts.
Absolutely. And pardon the pun. I think, Harris, I think the last few weeks we've seen increasing numbers of media, sort of news bulletins regarding the fact that the food industry, although it's an essential services, it is being impacted directly by the virus. You know, businesses closing. I think about literally the area that I live in, and a couple of days ago, 2 retail outlets were impacted and both closed as a result of workers testing positive. And like you said, we're very focused on the retail outlet because that's obviously where the public is still interacting and there are potential infection possibilities. But you're quite right. What is going on at farm level and other areas where there are just as many people that are possibly affected by the infection. I'm glad that you highlight the aspect of fear and this uncertainty, because I think one of the problems is that we have so little information about the pathogen. Every day there's new information that's being put out by the CDC, the WHO, and that's filtering down about this particular pathogen, and I think it's a scary place to be. You were saying that
you're absolutely right. I think we have to understand that our knowledge is evolving. You know, as you've said, every day there's a bit of new information coming through. And in science, we don't believe necessarily that one study is the be-all and end-all, because sometimes you get conflicting evidence. And so we have to move with where the evidence takes us. And science, in a sense, is self-correcting. But we can learn from the limited knowledge of previous coronavirus family outbreaks of SARS and the MERS, knowing very well that this virus appears to operate differently, and even to compare to other viruses such as flu and measles and other bacterial pathogens. So each one has its own particular method of operating and risks. In the beginning, when the COVID-19 disruption started, our team right from the beginning started to gather as much information as we could to package or to come to grips with what the virus means for the food industry. And much of which we have actually published on our COVID-19 webpage and released in our newsletters. So if you go to our webpage, you will see everything there, from hand washing to surface contamination to how it impacts on food. Is there risk? The first article that we published was, in fact, that this is not a foodborne hazard. Right from the beginning, we knew from previous research that you're not going to get sick from eating a food that contains this. And that's where the first bit of information, misinformation, started. But there are broad strokes that we can learn from this. And we went on to rationalize that this virus would fall in and could be considered in a food safety system as a biohazard. And that is where a lot of our strength of information comes from. How do we deal with biohazards? We understand from our training that biological hazards are a significant source of risk, and not only to human health, but also to have potential to cause major economic environmental losses. And we have seen this in real time with the COVID-19 saga. So from that point of view, it's no real different to other aspects with some novel approaches. If we look at Listeria had a major impact in many ways similar to what's happening now, but obviously not on the scale that COVID is impacting us on. Now, if we go back to the beginning, to the basis, we know that hazards can be classified into 4 primary categories: the biological, the chemical, physical, and allergenic. And these classifications are not new to the food industry. The foodborne biological hazards include microbiological organisms such as bacteria, fungi, parasites, and of course viruses. And so to put a face to these, consider the other diseases we've had to deal with in the food industry: the salmonella, the avian flu, swine flu, listeria, amongst others. And so foodborne diseases are a major global public health concern. According to the CDC, well-known American CDC, researchers have identified more than 250 foodborne diseases. That's a lot of foodborne diseases, and America constantly has outbreaks of many of these, and I'll point out 1 or 2 as we go along. And these organisms are commonly associated with humans and with raw products entering the food establishment, and sometimes with cooked food. And many of these microorganisms, as you know, occur naturally in the environment and even where foods are grown. Many can be minimized by adequate control of handling and storage practices. Hygiene, for example, how workers apply hygiene principles, temperature control, time. And we've learned a lot from other outbreaks and from other biological hazards. So if we know the
I think that puts us in a fairly unique position as the food industry, because given the risk assessment processes that we go through with other biological hazards, we have, I think, controls in place that help us to fight the enemy. But I think in this particular case, we don't know the enemy. And so, because we don't know the enemy, it's quite difficult to really understand the control measures that need to be in place.
You're absolutely right, but some of the characteristics are similar. So what is the origin? What is the transmission pathways? How do people and food, what is the interaction there with the environment? How does the environment impact this virus? Is it one that's heat stable, heat labile? So we know how to look at it and how to say why and how shall we address this? Where do we apply our risk mitigation strategies? So, for example, a case in point with biofilms. Biofilms was one of those background things we knew nothing about. But there's been a lot of work done on it, in particular with Prof. Peter Goos. And we know that biofilms is very different to anything else we experience. But from that knowledge, we know that our way of treating biofilms, the type of washing methods or cleaning methods are different. And our timing is different. And so we learn a lot from other diseases we've had to deal with and the disease interaction with the environment to be able to say, well, what do we need to consider when we deal with COVID? So a review article in the recent Journal of Hospital Infection, and this is where we're learning from other areas, published in March, just before COVID-19 hit South Africa, identifies methods to inactivate this virus. So we need to know, are the methods similar or different to other viruses or other biological hazards? We know we have to find a method. In this case, the solutions of 62 to 71% ethanol, 0.5% hydrogen peroxide, or 0.1% sodium hydrochloride, which is bleach, was the most effective in inactivating coronavirus within 1 minute of application. So we know principles, we apply the principles, and we learn from the principles. So that allows the food safety teams to consider the efficacy of the disinfectants they are using. Is that what you're using in your manufacturing plants? If not, what are you going to do to address this a little differently? We also know from the virus characteristics that it allows us that it's quickly degraded by simple use of soap and efficient hand washing practices. So for a worker, we don't have to go to extraordinary lengths compared to maybe other allergens, other biological hazards, or where the biological hazard might be sticking to your hands and you need to have a different approach to dealing with it. So this is valuable and useful information we've learned. And so we have to also understand that each biohazard has its own peculiarities and mitigating approaches. For example, and this I picked up yesterday, in the USA, deer droppings in a field is a food safety alert of the first degrees. Such droppings can contain potentially deadly E. coli pathogen and contaminate, for example, fresh berries or leafy greens. And in the USA, they constantly have leafy green outbreaks of different conditions.
Listeriosis?
Novavirus, and I'll be chatting a little bit. Novavirus. I'll be chatting a little bit later on that. So in a sense, what we are learning is that this biohazard has got commonalities, but it needs a different way to be dealt with.
I think, obviously, you've said to us that it's not foodborne, but the major problem that we're dealing with at the moment is the fact that this biological hazard is an occupational hazard. You mentioned yourself that, our workers are fearful. The food industry are still continuing to operate, but yet there's an extreme amount of stress on those people that are having to go to work every day while the rest of us are safely in lockdown, because they are on a daily basis being confronted with the very real risk that they're taking their lives into their hands. I think some of the things that you've said are very important for us as the food industry to note. Given the current cleaning protocols that we have, making sure that, we are using those current cleaning protocols, not only for food safety, but in fact, we are ensuring that we're cleaning properly for human safety. Because if I am using peroxide as a sanitizer, or I am using hypochlorite, it now has a double whammy in that it's protecting my staff as well as protecting my product, and the need to be very vigilant with cleaning. But I don't think it's, like you said, this is not the only disease that we should be considering when it comes to the food industry, and I mean this in relation to our workers. You mentioned salmonella. Our workers could very easily contract salmonellosis depending on the sector that we're working in. What about brucellosis? You know, depending on again the sector that we're working in, and then the thing that I think is very scary is tuberculosis. So while tuberculosis is not foodborne, according to the Stats SA report that was issued a couple of weeks ago, it still remains the third highest cause of death in South Africa, and that is very much an occupational disease where we have transmission, person-to-person transmission, if they're in close quarters. Now, I understand it's slightly different in terms of its method of transmission, but are these not biological hazards that, as the food industry, we should most definitely be considering, and possibly a little bit more, with a little bit more emphasis?
Linda, you're absolutely right, and that is a great point you're making. You know, we have to remember that right now there's 1 or 2 food companies that were making food that closed because of an effect on their workers, not on the food. And so we forget, we're so obsessed and focused on coronavirus as a disease, we are forgetting that our workers are central to what we do. Their health is central to our operations and how we care about them. We have to be kind to everybody, including ourselves and our workers. And so I was reminded particularly about this this analogy in an article in New York Times that pointed out that everyone's so focused on COVID-19 and on how hospitals are coping that we're forgetting and neglecting those that are still suffering with diabetes, coronary heart disease, renal failure, all of these other conditions. And South Africa is one of the top world leaders in heart disease, hypertension. And so these are conditions that haven't disappeared. Your workforce still have them. And so we should not lose focus on them. They occur concurrently with COVID-19. And we can draw that analogy with the fact on the food industry. So we should not forget that we're still at risk for other biohazards that still are going to occur in tandem with COVID-19. In particular, other diseases and occupational hazards in the food industry, such as salmonella, which you pointed out, avian flu, swine flu, they haven't gone away. They're sitting lurking somewhere. And in particular, and I'd like to concur with you on our staff with tuberculosis. Consider right now, what is your risk of your workers with TB? Now, obviously, how do you deal with them? Now, if they are stable on treatment, that's great, and they're working, and they're constructive, and they're helping. But they are nonetheless immunocompromised, and exposure to coronavirus may have devastating consequences to them and to your business. Are you addressing that? Are you aware of it? Are you focused on that? And so we have to consider, are there other biological hazards that may affect your workers as well as consumers? We can consider previous outbreaks of E. coli. They haven't gone away. Listeria, monocytogenes, they haven't gone away. There was a report 2 days ago of an alert on imported mushrooms into countries which were carrying listeria. Are we importing, or is your company importing listeria, mushrooms into the country? And if so, are you addressing it for other biological hazards such as listeria? Norovirus and diarrhea has a major impact on the USA food chain. We don't even watch here because there's no surveillance or reporting. So it happens, but we're not ever aware of it. This morning there's a story breaking of Chipotle, which many of you know is a big fast food chain in America, that is going to be paying a $25 million fine for tainted food. Basically, it was a spread of norovirus to consumers through inadequate biological hazard maintenance or screening in their food chain. We must not lose sight of these happening in the background. And so we forget that ingredients used in bakeries, once airborne, are hazards and can result in occupational disease. I think many people working bakery forget that about 10% of their workforce, this is bakery workers, are lost to the profession every year as a consequence of developing allergy to ingredients that occur in that environment.
Sure.
So remember also, concurrent to this crisis, other chemical hazards such as aflatoxins from imported products, if they are sitting on tankers waiting for importation or landing onto shores, there's a risk that aflatoxin levels increase because if it's damp conditions, they grow. Sudan red, we've had that outbreak before. Are we protected from Sudan red, or is this now the right chance for your supplier to sell you products from a second or third tertiary supplier because their normal channels are broken? So these may become prominent because of stress on our food systems, and we must not lose sight of that.
Now, I think, you know, we all agree that our government has acted decisively. Perhaps there could be some debate around should they have acted sooner. I don't think any of us are particularly enjoying the fact that the lockdown has been extended, although I think the data that we have available indicates why this is necessary. But we knew that this was happening in China in December. And I wonder, as the food industry, whether or not we should have been paying more attention to those news broadcasts and actually have preempted something in terms of what was waiting for us on the horizon.
I think you absolutely touched a raw nerve on exactly that point. And I think Chetan will be discussing this in his presentation on horizon scanning. You know, if we were thinking properly, we would have said Wuhan in China is one of the major exporters of a range of items, including possibly food. Does it export food? Does it export any raw ingredients? And how will it influence us down the line? And that's where horizon scanning comes in. The world over, people are looking to the governments and comparing actions of their governments with other governments from other countries to weigh in to see what action was taken. But we don't have, as companies and industry, we can't always just rely on our governments. We should be looking further ahead because sometimes governments are prescient and other times they are not. We can see that even America right now is struggling whether there should be a lockdown or not. Scientists are saying lockdown and politicians are saying, well, maybe not. But as a food industry, we look at this differently. We have to say, well, we're not dependent on our governments. We are dependent on ourselves and our role in this. You know, there are strikingly some examples of individuals throughout the world who took decisive action before the governments did. They not only had the foresight, but were astutely watching and interpreting signs. And some in America, for example, cancelled massive events and therefore had a major impact on preventing the spread of coronavirus before the governments did anything. So why did we not anticipate or predict the outbreak of COVID-19? Did your company have any strategies in place to deal with major biohazards or with products that you are importing from multiple centers around the world? You know, the head of Ireland's FSA, who is married to a South African, she gave a talk here a few years ago, and she reminded us and me of the fact that in Europe, when you make a pizza, it often contains products from 50 different countries. That's a lot of ingredients coming from many different sources. If your company is doing that, are you set up to actually look at the impact of where your ingredients are coming from, so that if there's a warning that something's happening in Spain, is it going to impact what your production's going to, the impact on the production? If it's in China, is it going to impact on your production? And what about your suppliers? So why did we not anticipate or predict the outbreak of COVID-19? We should be learning from this event. I mean, putting in place methodologies to predict the next biohazard. They're going to carry on happening. What practices, principles, and risk mitigation strategies will we institute to build a to build a robust food safety system for the country, for your own organization? How do we detect early potential biohazards in your environment? This is where the concept of horizon scanning plays a role. And this will be discussed, as I said, by Chetan. But just to emphasize that effective horizon scanning has the capacity to identify emerging risks across scientific, economic, and investigative sources. I want to give you an example. ANSES, which is the French Agency for Food, Environmental and Occupational Health and Safety, yesterday released a warning that turmeric-containing food supplements could disrupt the immune system by interfering with inflammatory defense mechanisms that fight infections such as the coronavirus. Same for echinacea. Is your company using turmeric as one of the major ingredients in a product? How are you going to deal with this if that news hits the media? Have you got a process of mitigating that risk? If you manufacture or sell products containing turmeric, did you pick up on this alert? Did anybody warn you? Are you linked into a system or to somebody who is giving you this information? The more we know about our macro and micro environments we interact with, the greater our chances of anticipating our risks and vulnerabilities. Remembering that although the first step is to decide what data needs to be gathered and who in your food safety team are responsible for gathering of this information, this is critical stuff you have to constantly be abreast of and update regularly. And when you understand data is only useful when interpreted correctly. You can sit with the right data and do nothing with it or incorrectly interpret it. And this is perhaps best done with cross-representation of role plays from your business. And this, I mean, not including just narrow-focused people who are food developers or food manufacturers, but people from your operations section, safety, finance, management, because the gathering of this data can assist the food company to identify which ingredients are at risk for food fraud, for example, to be alert for specific adulterants for the ingredients in question, who are your weak suppliers in your chain. You do not want to comprise a team of like-minded individuals because then you all think the same. You need to be able to have people who think out of the box and see the risk from a different point of view. For example, the marketing of your products. And so a good team is essential to mitigating and addressing this.
Now, I mean, what you're talking about sounds like VASIP. And what I'm picking up from what you're saying is that the methodology that we've been using to identify food fraud vulnerabilities, the important word is in fact vulnerabilities. And so, you know, as an organization, if we look at how we should be approaching a number of organizational risks, possibly the vulnerability approach or the methodology that is defined in the VASIP approach should now be extrapolated to other business risks to ensure that we are not caught napping. Is that what I'm hearing you saying, Harris?
Absolutely, Linda. You're absolutely right. You have to remember, a few years ago, there wasn't a term such as VASIP or TASIP, you know, and before that, HACCP was in non-existence until somebody, as we evolved, we started realizing, you know, there are ways of trying to mitigate with the problems that we are experiencing because the industry evolves, the way we manufacture food evolves, everything evolves. And so we have to carry on learning and evolving with that process. And one of these is VASIP. And VASIP training is incredibly useful. You know, currently we assist clients with VASIP training and we assess their raw materials. We provide an incident report. We use a range of resources, including food fraud software, which Chetan will address. We make suggestions on what analytical methods our clients should consider, including their testing schedules. These things evolve, you know, analytical methods that we thought worked 5-6 years ago. We're now finding inadequate. We have to find different ways of assessing it. You know, if you think of COVID-19, coronavirus was not a human disease or a foodborne related disease till SARS and MERS, which was only not many years ago. Things evolve. We have to have different analytical methods to address these things. So we have introduced the concept of horizon scanning. And if you remember, the last webinar we did together was around these topics, and we also presented a session at CEPOS last year on VASIP, as well as analytical methods, which Dr. Karim Diani, who's part of our team, presented on last year. So our interaction with food fraud solutions, our interactions with food fraud solutions we have offered so far have allowed us to understand the challenge of collecting and collating relevant and all-inclusive data with regards to both horizon scanning and to the risk of food fraud. And so as a consequence, my team, as I've said, it's a multifactorial team, have been considering which tools could support our clients in this area, understanding that it's evolving and we have to constantly see how it's evolved and what new information is available. And one of these, for example, tools that we use is the Decernis software-based tools, which have been helpful to us in seeing what's happening around the world and how does that teach us to be more vigilant.
Great.
How is it helpful to us, and how does it help us to equip our experience, which we can share amongst ourselves and with the food industry.
And so I think that brings us to the perfect point where I'm going to introduce Chetan, because Dr. Chetan Palmer is representing Decernis, and so I think this may be a great time for us to bring him in, Harris, to explain a little bit more about the Decernis platform and also in terms of how FACTS are actually working with Decernis to assist the food industry in South Africa. So Harris, thank you very much. I think it's great food for thought at this time. Thank you for some clarification in terms of how to address this biohazard for the food industry. So thank you for now. I'm going to say goodbye to you and I'm going to bring Chetan online.
Thank you.
Hi, Chetan.
Hi, Linda. Can you hear me?
Yes, I can hear you loud and clear, which is really great. Chet and I had a few nervous moments there because you disappeared into cyberspace, but I'm very, very glad that you are now back again. And so I'm going to hand over to you. I'm just going to take myself off webcam, and we're going to now focus on the screen because we have a really great presentation that Chetan is going to take us through. So I'm just going to move on to his bio. Let's just have a look and see. Sorry, I pressed the wrong button here. Let me just make sure that I'm moving on. Chetan, you have control of the mouse. Won't you do me a favor and just move the slide on for me, please? There we go. Okay, right. Thank you. Sorry that you had to introduce yourself from that perspective, but this slide gives you a very good indication of the Senior Vice President, Europe and Asia of an organization called Food Chain ID, and also the Managing Director of Decernis in Europe. Chetan has been had an illustrious career in the food industry, and he's been very involved with disruptive technologies, which is just an interesting term, but I think you can see that his work within Intertech, as well as other industries within the food industry, has really led him to the point where he is now involved with assisting the food industry with immense data gathering and this whole concept of ensuring horizon scanning. So Chetan, this is the second time we've had the opportunity to chat to you, so I'm very keen to hear what has evolved and what enhancements are there within the Decernis suite. Over to you.
Thank you, Linda. I hope the sound is good. I did have some technological challenges this morning while the webinar was going on, but hopefully those are resolved now. So thank you very much. I thought the discussion between Harris and Linda was very thought-provoking, and I do hope everyone on the line is keeping safe in this current climate. I know there's a lot of concerns about things going on just on a personal level, but it's a good time to reflect and also take stock of where you are as individuals, as well as as businesses as well. So before I start, I wanted to provide some background to Decernis. As Linda mentioned, this isn't the first time I've been on a webinar through Food Focus, but just wanted to provide some background. So Decernis was founded in 2003. It's headquartered in Washington, DC. It has got operations here in Europe. As you can probably tell from my accent, I'm based in the UK, and it's headquartered in Germany within the sort of European Union. Decernis, I think the last time I spoke, we were still an independent entity, but in June 2019, we joined the Food Chain ID family of companies. And Food Chain ID is a provider of technology-enabled testing, inspection, and certification services to support the new food economy. And it offers, amongst other things, certification services for non-GMO verification, organic certification, as well as food safety certification. And the Decernis part of Food Chain ID is really focused on technology, and this is where we're working together with Facts to support food businesses in their mission for safe, quality and authentic food. So today I'm here to talk a little bit about the concept of horizon scanning. I think Harris has introduced that very well, but also I want to walk you through some steps in terms of how you should be taking, what you should be doing to assess your vulnerability, particularly in the current global pandemic. So I'm trying to see how this works. Okay, so I thought I'd start off trying to outline a definition of the concept of horizon scanning, and I came across this definition from the OECD, which I thought was a good one, and I wanted to draw your attention to some key attributes. So firstly, horizon scanning is a technique to detect early signs of potentially important developments, and notably explores novel and unexpected issues, as well as persistent problems and trends that could create an impact to you. So quite an easy definition to grasp. And if you look at the OECD, oops, how do I go back here? Here we go. Got it. Okay. And if you continue to look at the OECD definition, it goes on to say that a solid scan of your horizon can provide the background to develop strategies for anticipating future developments and thereby gain valuable lead time. And I think you heard Harris mention that if there was foresight, Wuhan as a region in China is very sort of prominent in food industry, and therefore there should have been foresight in terms of what impact that could have had to the industry as a whole. So if we look at this OECD definition, it's quite broad and covers many industry sectors. And in our next slide, I've tried to provide some examples that are, I would say, pertinent to the food industry. So just broad examples here, so not really thinking about the pandemic at the moment, but some of the things that certainly we have seen at Decernis is where a scientific study has been published that questions the use of a particular ingredient or substance, and that can happen at a point in time, and then obviously regulations take time to catch up, and and that could be a year or a couple of years even, new regulations or can come into force, or existing regulations are amended that can potentially ban or restrict the use of that ingredient or substance. And the upshot of that is it makes, or has requires companies to reformulate and change their recipes, and as you're probably aware, that's quite an expensive process. So the earlier you know about that, the better you can plan. So looking for alternative ingredients and whatnot. On a side note, at Decernis, we offer a tool that helps companies stay on top of global regulations, and I'll mention a little bit more about that later on. Other examples, potential changes to food labeling laws, for instance, declaring certain substances on the packet rather than, for instance, declaring a generic term such as flavoring, or even more so if there are changes that are proposed which impact claims you can make about your product. Both of those have impact on the packaging that you're using, and the sort of marketing language on your product. So again, not an inexpensive change that you need to make. The final example that I've thought about was, and this is perhaps more relevant to today's discussion, is looking at how developments can impact your supply chain. And obviously there are things such as issues around harvest of certain crops, pricing issues, even political issues that prevent certain products being exported out of a certain country, but also pandemic issues. And this is something I'll talk about a little bit later on. So you heard Harris mention the concepts HACCP, TACCP, and VASAP. Actually, when Facts and I were talking about this webinar, they posed me a question about incident management versus horizon scanning. I thought I'll just quickly walk through the principles of HACCP, VASAP, and TACCP, and how incident management and horizon scanning are applicable across each of those principles. So a quick overview. I'm sure everyone's familiar with HACCP, or hazard analysis of critical control points. These principles are very much focused on food safety hazards and the processes and procedures to prevent foodborne illnesses, as Harris described. And after the horse meat crisis in Europe, the terms VASAP and TACCP appeared. And as you're probably aware, the food industry at the time was criticised for not having the foresight to spot what was happening, but also not having appropriate plans and procedures in place to mitigate or even detect those events. And really, the HACCP wasn't really designed for this, and that's how the terms VASAP and TACCP came about. I must admit, some people use those terms interchangeably, but in this slide I've tried to put simple definitions here, obviously together with help from some colleagues, in terms of what each term and principle means. So if we look at VASAP, which is vulnerability assessment and critical control point, it's very much focused on assessing for vulnerabilities that could lead to economically motivated adulteration or food fraud. And if you think of the horse meat crisis, we saw that didn't necessarily cause a food safety issue, but food fraud can lead to potential food safety issues. And if you think of adulterants that are potential allergens, then obviously if you're allergic to a particular substance, that can have severe impact and potential death as well in severe cases. Now, if we look at TACCP, that's really assessing for threats to your business, and so very much focused on food defense and mitigating against any what I call potential attacks that may cause harm. And these could, for instance, include security breaches to your premises, infiltration of your supply chain, basically anything that can involve malicious attacks and cause harm. So when you compare the three side by side, you can see that with both VASAP and TACCP, you need to be more aware of your external environment, including your supply chain, and therefore you need to be scanning the horizon for possible issues that could really impact your business. Now, if we look at how this has been transposed into food safety certification, then if we look at the various food safety certification schemes that are benchmarked by the Global Food Safety Initiative, you will have noted that since the horse meat crisis in Europe, all of them in some way changed the requirements in order to make sure that manufacturers consider and assess possible vulnerabilities to their businesses and put in place plans and procedures to mitigate against those. Of course, those standards continue to go through frequent version updates, and auditors have been trained accordingly, but suffice to say the principles of ensuring that you continue to assess your vulnerabilities have now become a prerequisite and part and parcel of the requirements of each certification scheme. Now, I must acknowledge that many food companies, certainly in South Africa, are not yet certified to a GFSI benchmarked certification scheme, and I know the country as a whole has been working very hard to improve the food safety culture within the industry, and companies such as Facts, and I know others have been working hard to impart knowledge. Nevertheless, even if you're not certified yet to a GFSI scheme, I would consider it best practice if you took some basic steps to consider the principles of VASEP and TASEP and apply them to your own business, including horizon scanning for potential impacts to your business, and consider developing mitigation plans around those, however basic they may be. And really the idea there is to get you into a good mindset and ensure you're thinking about every aspect of your business. So I realise the term horizon scanning rolls off the tip of certainly my tongue quite easily, but in practice it can be quite a daunting prospect for anyone. And what most people tend to do is conduct manual searches for information, including Google searches, looking at regulatory agency and government websites, industry news, or even obtaining information from suppliers. And in doing that, trying to move this along. In doing that, what most people find is that there is too much noise, and so they're not able to spot information easily. There's limited scope of their searches, and they come across conflicting information. So particularly if they're relying information from suppliers, in general, it can be a slow and laborious process. And I'll be honest with you, what generally happens is that because of the lack of visibility and timeliness, the process gets forgotten about, and more often than not ends up being a last-minute scramble to piece together information to develop or update records, particularly when you're about to be audited, be it by a customer, or hasten to add even a GFSI audit. And that's really the reality of people working in food safety, quality, having to grapple with a number of various different issues and challenges in their business. So I've gone through the basic definition for horizon scanning, introduced you how it can support you, your businesses, as well as the challenges of trying to actually conduct and perform a horizon scanning exercise. I wanted to, at this stage, just briefly mention how some of the Decernis tools can help you with this. We have 5 products on the market. As I mentioned, some of these, such as G-Comply and G-Comply Plus, can help you manage regulatory compliance. But the 2 I did want to highlight that could support with assessing vulnerabilities are first the food fraud database, and secondly the Decernis horizon scanning and predictive analytics platform. Does that by tracking thousands of various sources of information online, including industry news, official sources, general media, social media, and various other aspects of the scientific community, for instance, and it uses a synonym library to track over 5 million terms across 40 different languages. So it's a very highly focused and intelligent search engine that will essentially bring you pertinent information at your fingertips. Now, coming back to the topic of food fraud vulnerability assessments, there are obviously other resources available, and here are some of those resources, not only to help you gather data sets, but also in terms of the methodology. I won't go into these in too much detail, and the references are here. I'm sure the slide deck will be made available later, so please have a look at those at your leisure, after this webinar. So if we if we now take a look at the principles of vulnerability assessments and the concepts of VASAP, TASAP alongside HASAP, then how can you apply these during a biohazard pandemic and obviously in the current situation? Before I talk a little bit about this, I wanted to mention one thing in terms of how technology can help. And we were recently approached by a fairly large government organisation who posed a few questions to us. The first was, what is the impact of COVID-19 on food, and is food a potential vector? I must admit these questions were posed several weeks ago, and obviously a lot has been published since then. But you know, this was a challenge that they were putting forward to us. And the other question they asked us was, how can we monitor food trends for food frauds, incidences, regulatory issues related to supply chain disruptions? So on the first question, we put use to the Horizon Scanning and Predictive Analytics platform to create a series of profiles and track and find relevant official sources and scientific opinions on these issues. And as I said, I know this is now a few weeks old, and I think Harris has also discussed about it earlier on, but you can see that we're able to determine you know, from several sources of information that food is not a vector for the virus, and that's something that the government organisation appreciated. The second one question, you know, we took this a little bit further, and I think Harris has mentioned a little bit about food packaging. You know, and the question was whether we asked ourselves was whether the virus can be transmitted by food packaging, so cartons, films, boxes, etc. Again, this news is old, but you can see we're able to find articles and published reports that determine that the coronavirus can survive on packaging, but is relatively short-lived and therefore poses low risk. Using that information and also you know, information about potential issues around food fraud that could occur, we then decided actually to use that information that we collected and you know, using the approach of scanning the horizon to create what we call a weekly digest on COVID-19 related to food industry, and this is available free on the Food Chain ID website. It's also on the Decernis website, and it's free to download, and you know, the information is pulled on a weekly basis, and there are you know, archive digests that you can also download and have a look at. And as you can see from the contents of what I've shown, you know, we're looking across the globe in terms of various different issues being reported around the world. So coming back to vulnerabilities, I should point out one thing is that obviously in the modern world, the food industry, very much like other industries, we operate in a world of just in time. So you know, there aren't significant inventories of products or ingredients. Generally speaking, obviously for commodity products, there are you know, obviously due to harvest and whatnot, you know, that there are storage, you know, stored products that are required and released. But generally, in time of a crisis, the industry as a whole is prone to disruption, particularly in a global pandemic. And bearing this in mind, and having spoken to customers as well as looking at various different sources, we are you know, noticing you know, this being an impact right now, and certainly if we're looking at manufacturing of ingredients, you know, we've heard from customers that, you know, they're finding it difficult to source things like sweeteners and dietary supplement ingredients, and this might not impact you directly in your business, but you know, if you're working in the beverage sector, for instance, or sports nutrition, it could pose some challenges. Secondly, there's an increasing complexity in the supply chain, and we've noticed that some customers have had to consider shifting supplies if their supply production plants have had to close or have had a reduced output due to the coronavirus. And then this poses potential issues with how do you vet new suppliers on an emergency basis. And I heard about this, an example just yesterday of a fairly large client who's had to undertake emergency procedures in order to do that. And sort of thirdly, many countries have adopted what are called temporary import restrictions, some even export restrictions, as countries are trying to take an approach of me first. We've noted, issues around freight transportation, either by sea or air, and obviously logistic companies have either been impacted themselves or have to try and figure out alternative ways in which to get goods from one country into another. So obviously with all this increasing complexity there, it does provide a recipe, and I would pardon the pun, for fraudulent activity to take place. If you think of criminals, they use things like this to really exploit the industry. So obviously, I suggest that everyone does pay attention to potential fraud in your supply chain. I should also mention there are secondary gaps which will start to appear, certainly in the Northern Hemisphere as we move into our main harvest season. Many countries are reporting potential issues with picking crop, such as fruit and vegetables, and not enough resources available in country. This may not necessarily create an immediate impact, but if it's not resolved, could create a delayed reaction in scarcity, pricing, and all the other consequences that I've noted above. So my last slide, what can you do and how should you be tackling your vulnerabilities currently certainly in the current climate? I should point out that we do live in a very fast changing world right now. The current pandemic has created many challenges and increased complexity for many, be it managing the workforce, and I think Harris and Linda have talked about that, but also customers and suppliers. So I just wanted to summarize what you can do to protect your business and try to stay on top of changing events. So number one, stay current on latest developments that are relevant to your business. Obviously there are tools out there that can help you. And also, services that can be used to help you as well. Number two, do check your policies and procedures as the situation demands. If you do need to consider new suppliers, try to think of how you can vet them in the current pandemic climate. Really just don't forget the basics there, because at the end of the day, you've got a duty to manage food safety. And number three, do plan for disruption. Although today I've tended to focus on vulnerabilities in your supply chain, you do need to stay on top of your internal factors such as the workforce and working environment. I'd hasten to add also talk to your customers and how they may be impacted by the pandemic. So the message really from me is use the principles that I've highlighted. Really try to plan for the worst and hope for the best. So that's all from me. I hope that's been useful. And over to you, Linda.
Thank you so much, Chetan. That was really, really great. I cannot believe how much you managed to stuff into those few slides. And for those of you that are listening, we will definitely make the presentation available, and I would strongly suggest that you use all the resources that have been so freely shared to go back and look at your VASIP and TASIP systems. As Chetan mentioned, there's lots of opportunity to share information, have a look at the digest. I think there's just a wealth of help that was shared with you in a few slides. And so thank you so much for being so generous with that knowledge, Chetan. We really appreciate it. Ladies and gentlemen, we have run out of time, and so I'm going to ask that if any of you have any specific questions on the services that are offered by Facts or Decernis, could you please send an email to marketing@factssa.com. Facts factssa.com, and the team at Facts will be very, very happy to point you in the right direction and to provide you with more information. For those of you that have registered on the webinar, you'll also be hearing from them shortly with some more information, and so you can look forward to that. To my guests today, Dr. Chetan Palmer, Dr. Harris Steinman, thank you so much for helping us to look at the current pandemic in a slightly different way, helping us to identify that the measures that we have for biohazards have stood us in good stead, and we can use them to assist us in the dealing with this pandemic when it comes to our staff as well as our products. And then the importance of horizon scanning and making sure that we have access and are tapped into tools that can provide us with reliable, credible information about what's about to hit us next. So thank you so much, everybody. Thank you for being with us during the course of today's webinar. We trust that you have a good day further, and please stay safe.
Tracking thousands of various sources of information online, including industry news, official sources, general media, social media, and various other aspects of the scientific community, for instance. And it uses a synonym library to track over 5 million terms across 40 different languages. So it's a very highly focused and intelligent search engine that will essentially bring you pertinent information at your fingertips. Now, coming back to the topic of food fraud vulnerability assessments, there are obviously other resources available, and here are some of those resources, not only to help you gather data sets, but also in terms of the methodology. I won't go into these in too much detail, and the references are here. I'm sure the slide deck will be made available later, so please have a look at those at your leisure, after this webinar. So if we now take a look at the principles of vulnerability assessments and the concepts of VASAP, TASAP alongside HASAP, and how can you apply these during a biohazard pandemic and obviously in the current situation? Before I talk a little bit about this, I wanted to mention one thing in terms of how technology can help, and we were recently approached by a fairly large government organisation who posed a few questions to us. The first was, what is the impact of COVID-19 on food, and is food a potential vector? I must admit these questions were posed several weeks ago, and obviously a lot has been published since then. But this was a challenge that they were putting forward to us. And the other question they asked us was, how can we monitor food trends for food frauds, incidences, regulatory issues related to supply chain disruptions? So on the first question, we put use to the horizon scanning and predictive analytics platform to create a series of profiles and track and find relevant official sources and scientific opinions on these issues. And as I said, I know this is now a few weeks old, and I think Harris has also discussed about it earlier on, but you can see that we're able to determine from several sources of information that food is not a vector for the virus, and that's something that the government organisation appreciated. The second question, we took this a little bit further, and I think Harris has mentioned a little bit about food packaging. And the question was whether we asked ourselves was whether the virus can be transmitted by food packaging, so cartons, films, boxes, etc. Again, this news is old, but you can see we're able to find articles and published reports that determine that the coronavirus can survive on packaging, but is relatively short-lived and therefore poses low risk. Using that information, and also information about potential issues around food fraud that could occur, we then decided actually to use that information that we collected and using the approach of scanning the horizon to create what we call a weekly digest on COVID-19 related to food industry, and this is available free on the Food Chain ID website. It's also on the Decernis website, and it's free to download, and the information is pulled on a weekly basis, and there are archive digests that you can also download and have a look at. And as you can see from the contents of what I've shown, we're looking across the globe in terms of various different issues being reported around the world. So coming back to vulnerabilities, I should point out one thing is that obviously in the modern world, the food industry, very much like other industries, we operate in a world of just in time. So there aren't significant inventories of products or ingredients. Generally speaking, obviously for commodity products, there are obviously due to harvest and whatnot, that there are storage, stored products that are required and released. But generally, in time of a crisis, the industry as a whole is prone to disruption, particularly in the global pandemic. And bearing this in mind, and having spoken to customers as well as looking at various different sources, we are noticing that this being an impact right now, and certainly if we're looking at manufacturing of ingredients, we've heard from customers that they're finding it difficult to source things like sweeteners and dietary supplement ingredients, and this might not impact you directly in your business, but if you're working in the beverage sector, for instance, or sports nutrition, it could pose some challenges. Secondly, there's an increasing complexity in the supply chain, and we've noticed that some customers have had to consider shifting suppliers if their supply production plants have had to close or have had a reduced output due to the coronavirus. And then this poses potential issues with how do you vet new suppliers on an emergency basis. And I heard about this, an example just yesterday of a fairly large client who's had to undertake emergency procedures in order to do that. And sort of thirdly, many countries have adopted what are called temporary import restrictions, some even export restrictions, as countries are trying to take an approach of me first. And we've noted issues around freight transportation, either by sea or air, and obviously logistic companies have either been impacted themselves or have to try and figure out alternative ways in which to get goods from one country into another. So obviously with all this increasing complexity, it does provide a recipe, and I would pardon the pun, for fraudulent activity to take place. If you think of criminals, they use things like this to really exploit the industry. So obviously, suggests that everyone does pay attention to potential fraud in your supply chain. I should also mention there are secondary gaps which will start to appear, certainly in the Northern Hemisphere as we move into our main harvest season. Many countries are reporting potential issues with picking crop, such as fruit and vegetables, and not enough resources available in country. This may not necessarily create an immediate impact, but if it's not resolved, could create a delayed reaction in scarcity, pricing, and all the other consequences that I've noted above. So my last slide, what can you do and how should you be tackling your vulnerabilities currently certainly in the current climate? I should point out that we do live in a very fast changing world right now. the current pandemic has created many challenges and increased complexity for many, be it managing the workforce, and I think Harris and Linda have talked about that, but also customers and suppliers. So I just wanted to summarize what you can do to protect your business and try to stay on top of changing events. So number one, stay current on latest developments that are relevant to your business. Obviously there are tools out there that can help you, and also services that can be used to help you as well. Number two, do check your policies and procedures as the situation demands. If you do need to consider new suppliers, try to think of how you can vet them in the current pandemic climate. Really just don't forget the basics there, because at the end of the day you've got a duty to manage food safety. And number three, do plan for disruption. Although today I've tended to focus on vulnerabilities in your supply chain, you do need to stay on top of your internal factors such as the workforce and working environment. I'd hasten to add, also talk to your customers and how they may be impacted by the pandemic. So the message really from me is using the principles that I've highlighted. Really try to plan for the worst and hope for the best. So that's all from me. I hope that's been useful. And over to you, Linda.
Thank you so much, Chetan. That was really, really great. I cannot believe how much you managed to stuff into those few slides. And for those of you that are listening, we will definitely make the presentation available, and I would strongly suggest that you use all the resources that have been so freely shared to go back and look at your VASIP and TASIP systems. As Chetan mentioned, there's lots of opportunity to share information, have a look at the digest. I think there's just a wealth of help that was shared with you in a few slides. And so thank you so much for being so generous with that knowledge, Chetan. We really appreciate it. Ladies and gentlemen, we have run out of time, and so I'm going to ask that if any of you have any specific questions on the services that are offered by Facts or Decernis, could you please send an email to marketing@factssa.com. Facts, FACTSSA.com, and the team at Facts will be very, very happy to point you in the right direction and to provide you with more information. For those of you that have registered on the webinar, you'll also be hearing from them shortly with some more information, and so you can look forward to that. To my guests today, Dr. Chetan Palmer, Dr. Harris Steinman, thank you so much for helping us to look at the current pandemic in a slightly different way, helping us to identify that the measures that we have for biohazards have stood us in good stead, and we can use them to assist us in the dealing with this pandemic when it comes to our staff as well as our products. And then the importance of horizon scanning and making sure that we have access and are tapped into tools that can provide us with reliable, credible information about what's about to hit us next. So thank you so much, everybody. Thank you for being with us during the course of today's webinar. We trust that you have a good day further, and please stay safe.